I recently attended 3 courses in 5 days at the DNS Symposium in Chicago. DNS is a technique known as Dynamic Neuromuscular Stabilization, and it was such a great experience. The developer of DNS himself, Pavel Kolar, as well as a great team of people, flew over from the Czech Republic, as well as instructors from around the US to allow us to learn directly from them. I wanted to share with you some of the great concepts we discussed and help you understand how this technique might be used during your care. The beauty of these principles is in the fast, long-standing results that we can make, and in one visit we can assess, treat, reassess to see if we've made an impact and ensure that we're on the correct path. Over several visits, we can address multiple areas of concern all together with one set of appropriate exercises, seeing long-term changes in between visits. That means that we can address your plantar fasciitis, your IT band syndrome, your low back pain, and your neck pain efficiently by addressing the underlying cause and not just chasing symptoms all over the body. DNS, or Dynamic Neuromuscular Stabilization, is a specialized technique that helps us optimize the patient's movement system. What I mean by that is it allows us, the clinician, to identify and then retrain fundamental flaws in movement strategies, i.e., how do you accomplish a task like squatting, throwing, running, or just reaching for your coffee cup during the day. Improper strategies often lead to injury and are an underlying cause of possibly a current injury. Like everything, this technique gets used in conjunction with other tools because we need to make sure that we're fitting the best tool to the problem. So let's talk a little bit more about what DNS is. DNS is based on the science of developmental kinesiology, basically how we learn movement as babies. In a healthy, normally developing baby all around the world, the strategies for rolling over or crawling or pulling ourselves up or squatting, they're all very similar. The reason for this is that our nervous system, our brain, is hardwired with patterns to achieve this. Nobody taught the baby to roll over in that specific pattern. They just did. We can use these patterns in children through adults to encourage the whole body to work together to stabilize or create movement. Here's an example. Let's say you have a rotator cuff tear in your shoulder. In traditional rehab, the rotator cuff is viewed largely as helping with rotation of the shoulder, which it absolutely does. So many of the exercises that we use for rotator cuff involve pulling bands in or out to strengthen the muscles. More importantly for function, the role of the rotator cuff is to control the centration of the shoulder joint, meaning it helps the ball stay in the center of the socket. But it doesn't function alone. It functions as part of a giant puzzle. Your back muscles, your chest muscles, your core muscles, even your hip muscles contribute to create a base of support that rotator cuff can work against or work with. So wouldn't it make more sense and wouldn't it be better to strengthen the rotator cuff in conjunction with everything around it so that it really learns to function in the way that it has to be utilized in everyday life? That's what DNS allows. In a moment, you're going to see me working with Katie as I work through an exercise that actively involves the shoulder, but it also involves her hips, her core, her back, her chest, so that she's using a pattern that you can see all around the world, babies doing every day, and we're going to use this pattern to teach the shoulder to function properly. Thanks for joining me for a quick look into dynamic neuromuscular stabilization. I hope this helps you understand a little bit more about a technique many of you have seen in the office. The 5-day intensive training has helped me improve my skills with this technique, build relationships with amazing providers around the globe, and continue my pursuit to provide the most effective research-backed care for my patients.